Hi again, it's Dr. Gordon. Someone asked, why do GLP-1s work? They work because obesity is not a willpower problem. It's a disease of dysregulated physiology. GLP-1 medications work by correcting the signals that are broken. They reduce pathologic hunger, they slow gastric emptying so you feel full sooner and longer, they improve insulin sensitivity, they lower inflammation, they quiet the constant food noise that makes sustained behavior change nearly impossible for many people. In other words, they don't force weight loss, they lower the biologic resistance to it. So this is why people can suddenly do the same things they've always tried and get a different result. Not because they became disciplined overnight, because their physiology finally stopped fighting them. So let's talk about the real problem though. The medical system pretends these medications are optional or cosmetic. Insurance companies call obesity a lifestyle issue, so they don't have to pay for treatment. Yes, cost containment is part of it, but there's something bigger. A population that is inflamed, exhausted, hungry, and metabolically sick is easier to manage than one that is healthy, clear-headed, and energetic. When people get healthy, the control ends. That's why access is restricted. At least that's my opinion. That's why patients are shamed. That's why effective treatment is delayed. GLP-1s aren't magic. They're not a shortcut. And they're not enough on their own. But they are one of the first tools we've had that actually treats the disease mechanism of obesity instead of blaming the patient. That's the way they work, and that's why they're controversial. Follow me for obesity medicine grounded in physiology, not blame.